Hi, I'm Erin.
I'm Sam.
And I'm Brittany. Thank you, Elizabeth, for your question. And this is our synthesis project on your topic of the impact COVID-19 has had on cognitive function in older adults with Alzheimer's and related dementias. So for a little bit of background and goals, COVID-19, the worldwide pandemic, has changed the way that all individuals live their lives and participate in occupations. COVID-19 has greatly impacted the older population, but in particular, the older population with Alzheimer's disease and other related dementias. Alzheimer's disease typically presents symptoms of cognitive decline like memory loss that upsets daily activities, decreased judgment, changes in mood or personality, and difficulty completing familiar tasks and activities. So, a lot of research has been done on Alzheimer's disease and other dementias, but there's a lack of research on how COVID-19 has affected this population cognitively. The potential for increased stress, anxiety, and psychological trauma resulting from COVID-19 isolation may result in accelerated cognitive decline for this population. So we seek to answer this through your research question. What impact did COVID-19 have on cognitive function among older adults with Alzheimer's and other related dementias? And I will pass it on to Erin, who will explain our methods in choosing articles to synthesize.
So, research articles were found using Medline, CINAHL, Google Scholar, and RU Supersearch. Some keywords that were used in the search included geriatric, elderly, Alzheimer's, dementia, cognitive decline, pandemic, COVID-19, hospitalization, and isolation. All of the articles were synthesized were published within the last year and were scholarly and peer review articles. Due to COVID-19 being so recent and ethical concerns, only one study included a deep statistical analysis. Articles were not reviewed if they did not address clients that presented with dementia or Alzheimer's. From all the research, we found three major themes, and Brittany will list the first one.
The first major theme that we found throughout our research is that the Alzheimer and related dementia populations are at an increased risk for infection and increased mortality as it relates to contracting COVID-19. Brown states that the number one reason for this is their difficulty following the recommendations to slow the transmission of COVID-19. Some of these recommendations include hand washing, wearing a mask, covering of the mouth and nose when coughing or sneezing, reporting their symptoms, maintaining that 6-foot distance from others, and self-isolating within their homes. The older population with severe dementia have a hard time understanding the risk of infection and the need for these regulations. And Sam will introduce our second theme found.
Our second theme that we found throughout our research was quality of life. COVID-19 has both a direct and indirect effect on the quality of life for Alzheimer's and dementia populations. In one of our research studies, IADIS states that if patients are hospitalized, they experience greater anxiety, anger, stress, and agitation. As a result of this, these patients tend to close themselves down, and there's no longer a motivation to continue to live with the major changes that the pandemic and COVID-19 has brought to everyone's life. Indirectly, because of these changes, COVID-19 has limited individuals' access to resources. Relating to limited resources, the Alzheimer's and dementia population are of advanced age and may have a hard time understanding, comprehending, and accessing valuable information on the internet because of lower cognition and lack of technology knowledge. Now on to Erin for our third and final theme.
The last major theme to discuss is cognitive effects on the dementia population. A major finding from one of the articles, SOBRA, was that COVID-19 impacts cognition and mood behaviors like depression and anxiety on clients with dementia. Based on the results, the study observed an increase in hallucinations, agitation, aggression, depression, anxiety, irritability, and sleep disturbances, based on the subjects that underwent pre-medical consultations since COVID-19. The study also found significant differences in the burden of caregivers between those who had medical consultations versus those who did not. In the Alonzo-Lana study, there was also prevalence of insomnia, depression, and anxiety. The study showed that subjects with dementia and Alzheimer's diagnosed with COVID-19 in the hospital showed symptoms of altered mental status, new onset psychosis, and other related psychiatric disorders. The article also showed that patients with dementia had a more serious symptoms like confusion, disorientation when developing COVID 19. The COVID 19 pandemic has changed what life looks like for everyone, particularly on those with Alzheimer's and other related dementias. These three major themes are directly related to COVID 19 and our population. So, what does this mean for occupational therapy, and what can we do to help? Now, on to Sam.
The implications of this research for occupational therapy is that increased awareness and education for both healthcare providers and caregivers is pertinent to lower the risk of infection, as well as looking for exacerbation of cognitive, behavioral, physical, and affective symptoms that may be occurring due to infection. Patients with dementia and Alzheimer's are at a much higher rate of contracting the virus due to not being able to comprehend independently and consistently follow the guidelines that the CDC has developed in limited access to in-person healthcare during the pandemic. Special interventions and care should be given to individuals with dementia. Occupational therapists may introduce patients and their caregivers to resources like FaceTime and Zoom to allow for patients to continue to get social support. They should also encourage patients with dementia to have all of their healthcare services through telehealth, if possible, to lower the risk of infection. Telehealth services will help lower the risk of the patients contracting the virus, but will also allow for physicians to practice preventative care with their patients. Occupational therapists may also encourage patients to continue to participate in leisure activities and other occupations that they enjoy from their home by introducing adapted ways to participate in occupations through things like FaceTime and Zoom and other internet sources. Our last implication for occupational therapy is education for caregivers. Caregivers should be educated on the risk and the symptoms that may be shown in patients and their loved ones that have dementia and Alzheimer's. Occupational therapists should take all these common factors into consideration for their patients with dementia, and they should also recommend activities that would increase occupational engagement, education that will help lower their risk of contracting the virus, and further education for caregivers to understand, spot the symptoms, and deal with the increased mood behaviors mentioned throughout our research. Now we will be moving on to our conclusions.
To wrap this up, I know this is a lot of information, but we should realize how important it is to be aware of the negative impact of COVID on dementia and Alzheimer's patients. From listening to what Sam said about the impacts of occupational therapy has, we can help with getting people with dementia access to resources, making sure families are having that social interaction with their loved ones, whether it's outside or through technology, making sure that your clients have opportunities for occupational engagement, and helping out their support systems, making sure the caregivers are educated and feel supported.
Our third conclusion that we found all throughout our research was that Alzheimer's and dementia populations that did contract the COVID-19 virus had increased progressive decline in cognition and affect seen through behavioral symptoms, along with a decreased quality of life, which was seen all throughout our three major themes that we talked about earlier.
And lastly, it's important to note that further research must be done to evaluate specific negative long-term cognitive effects due to the newness of COVID-19 and its ongoing effect with not only this population, but the rest of the world. And we just want to say thank you, Elizabeth, for your question, and we enjoyed researching a topic so important to OT.
Thank you.
Thank you.